Hey there, medical coders! Welcome back to the channel. In this episode, we will be discussing about radiology coding. I am the medical coding guy. By the end of this video, you will have a clear understanding of how to make radiology coding not just easier but more accurate and efficient, especially to those people who will be taking the exam as well. First things first, let's talk about what radiology coding actually is. Radiology involves imaging techniques to diagnose and sometimes treat diseases. As coders, we translate these procedures into codes which are very crucial in billing and insurance purposes. But it's not just about memorizing codes, it's about understanding the process and applying them correctly in real life. And these are the contents of radiology codes, from diagnostic imaging to diagnostic ultrasound to radiologic guidance. These are the first three that we will discuss for this video, and the remaining parts will be uploaded to the second part of this video series. One of the most important things to remember is who took and interpreted the image. In both exam and in the actual practice, it's very important for you to know who took and interpreted the image. Is it the same doctor who took and interpreted the image, or is it a different doctor or a different entity? Let's say, for example, the doctor took a single view chest x-ray. Now, we have two components to check. The technical component, which has a modifier TC, right? And the professional component, which has a modifier 26. So, technical component is the one who performed the imaging. So, apply modifier TC for that entity or person who took the image and not interpreted the image itself. All right. As for the professional component, this is going to be given for that person or entity who interpreted the findings. And if it's the same person or same doctor who performed both, then we will be using the global modifier concept. We will not be putting any modifier towards that code. So as you can see, just simply code 71045, for example, for that single view chest x-ray that was performed for the patient. Okay. So please take note of this. We have an example here. A 55-year-old male presents to the emergency department with complaints of shortness of breath and persistent cough. Now, the attending physician ordered a chest x-ray. When it comes to reporting this radiologic procedure, especially the x-ray, guys, you have to check the number of views and the site where the doctor performed the procedure. So in this case, we have a PA and one lateral. But remember what I told you earlier? Who took and interpreted the image? So it's Dr. A, who is the radiologist from an outside lab, performed that chest x-ray. And the interpretation of the findings was performed by Dr. B. So it's two different doctors. So check the question that's asked. So in this case, we have, please report the code for Dr. B. So we will be reporting here the code for that doctor who interpreted the finding. So going back to this one, we will be getting the professional component. All right. So apply modifier 26 for that. 71046 should be the code. All right. So again, if you go to 71045 and 71046, this 71046 code is for 2-view chest x-ray, while 71045 is for 1-view only or single view chest x-ray. All right, so we will eliminate this, check the modifier. All right, modifier 26 should be applied here. Easy and simple. So in the exam, in the CPC exam, guys, there are some questions that appears like this, so be very careful about the one that you will choose. Okay, so next is you have the diagnostic ultrasound procedures. All right, so again, bulk of your codes from the radiology section of your CPT codebook contains diagnostic imaging. All right, from X-ray, CT scan, MRI. And now for diagnostic ultrasound, you only have few codes here, but there are a few things to remember. Okay, so take note, guys, that if an ultrasound will be performed, we also call it sonography. It's a non-invasive imaging technique that uses high-frequency sound waves to produce images of structures inside the body. So the doctor will order this one to diagnose a certain problem for the patient. All right. And here are the following examples of diagnostic ultrasound that you can find under this section. As for the guidelines, guys, take note that you have to check the organ or part to be examined and checked. In some codes, it will be mentioned as complete or limited. Is it the entire part or just a limited part of that specific region? For example, we have a 76700 code here. That's for ultrasound abdominal. All right, it's mentioned here as complete, or 76700. As for 76705, we have limited, which is only for a single organ, quadrant, or a follow-up check. If any of those were mentioned in the scenario, you have to code limited. All right, so let's say, for example, this one. Okay, a 45-year-old male presents to the clinic with complaints of fatigue, jaundice, and upper right quadrant abdominal pain. Now, this patient has history of alcohol use disorder, and the physician suspects liver disease. An ultrasound of the liver is performed. There's no actual code for ultrasound of liver directly, but we have to get that code from, code from this abdominal ultrasound. All right, if it's a single organ ultrasound, we will be applying this code. We will only apply it as limited ultrasound of the abdomen because it's just the liver the doctor has checked for today's visit. Okay, so yeah, so what's the code that will apply then? So if you go back here, choose any of the two, eliminate the other choices here. 76700 and 76705 are the choices here. Eliminate this two. Now, since it's only for the liver, we will apply limited ultrasound for this scenario. Okay, so those are some of the types of questions you might be getting in the exam, or even in real life, guys. You have to be very particular about this specific part or area. Check if it's complete or limited in some codes. Okay, next one is for radiologic guidance. So this is what's confusing about the radiology topic or the radiology section. Okay, now if a guidance was used by the doctor to help him do the procedure or do the surgery for the patient, all right, this radiologic guidance can be coded or not. It depends on the description of the main code, the main procedure that's performed, all right, where the doctor will be using a radiologic guidance to help him. Okay, so that's the reason why we code radiologic guidance. If it's not embedded or if it's not in the description of the procedure, and you have to follow some guidelines like do not report or use this code if you will be coding for radiologic guidance. All right, but there are some steps here you need to make. Okay, so check the type of guidance that's used. If you go to your CPT code book, guys, you will see you can find your radiologic guidance codes under 77001 to 77032. Right, only contains few codes, but again, we will notice this a lot in some choices, so please double check. So you have, for example, this one, fluoroscopic guidance. So you have different types of guidance procedure that can be used in conjunction with another surgery or another treatment or procedure. CT guidance, and then you have MRI guidance, magnetic resonance imaging. Basically, you have this fluoroscopic guidance, ultrasound guidance, magnetic resonance guidance, and CT scan guidance. So double check the type of guidance that's used. And number two is double check if it's already included in the description of the code to see or check that the main procedure, all right, because it might include already the guidance. For example, if you go to 36572 under peripherally inserted central venous catheter under cardiovascular series, it's already mentioned here, including all imaging guidance. So you don't have to code the radiologic guidance in conjunction to this code because it already includes the imaging guidance that you will use, right? So you don't have to report it. For example, we have this question. A 60-year-old female patient requires a PICC line, all right, with port for chemotherapy administration. Now, the doctor performed this procedure under or using fluoroscopic guidance. Now, if you go back to the description of this code, so this is PICC, all right, if you go to that procedure, so let's go there real quick, 36 something. Oh, what's that code? 36572. All right. If you go to 36572, guys, onwards, you will find here, see PICC codes, right? 36568 onwards, all right? But the scenario here states that it's with port. So PICC line with port. So double check that. So this is without port. This is without port as well. This one with subcutaneous port. However, unlike this code right here, it says including all imaging guidance. And it's mentioned here even that you don't report this with some of this guidance procedure. And in this description, you don't find those terms. So we can report the radiologic guidance in conjunction with PICC line with port. What's the code for that? What's the age? It's a 60-year-old patient, so this is the one that we will choose. Age 5 years and above, plus the fluoroscopic guidance code 77001. Okay, those are the important things you need to remember for the first 3 parts of the radiology coding. All right, and on our next video we'll be discussing this next 4, which is kind of more complex than the first 3. All right, but most of the questions will revolve around the first 3 here. Okay, but watch out for our next video. I will be uploading soon. Take care. Always remember, without knowledge there is no power. See you next time.